evening, everyone. We're going to talk about uncertainty with MS and kind of how to cope with that. And I wanted to thank our sponsor, Viatris. Thank you so much. They've been sponsoring the MS Mental Wellness Chat for a good while now, and we appreciate their support. And thank you for MS Views and News for bringing this program to the MS community for over 3 years now. Okay, so we're going to talk about the elephant in the room here. So I came up with these topics probably about 5, 6, 7 months ago, and I wanted to talk about navigating, things when it's uncertain, because MS is a unpredictable disease. And here we sit, this week. Amidst a lot of change. We have a new president. I am not getting political, and I nor will I make this political at all. But there's been a lot of change, and so with and I feel like that just can create a little bit of uncertainty for some people, and for some people it might not. So I was thinking about during the COVID period, resources that I shared generally about uncertainty too. And so I'll probably blend a little bit of that in because the topic is timely for a couple of reasons. But again, this is not about politics. This is about MS, but a lot of the resources are going to be transferable. And at the same time, we just need to say that there's the elephant in the room. There's some uncertainty and some people are feeling uncomfortable. So we'll move on from that. We'll move on to our next slide. And then I want to create this a safe space. So I just shared the elephant in the room, which I think it's very fair, but this is a safe space, so we're not going to stay on politics. We're just going to, I will do some general uncertainty stuff, but we're going to be talking mostly about it in this context with MS. And I love this mental wellness chat. We are such a good group and a good team and a good support to one another. So I always want to make this a safe space. Kanita did say something, and I think that this is actually a really relevant point. It would be relevant to me as well, that she's worried about copay assistance programs. And Kanita, what I would say is for, I think that's very reasonable to be worried about. Often those are held through the pharmaceutical companies. But I would follow closely with the National MS Society, MS Views and News, MSAA, and advocacy, because I'm sure that they're going to be following that as well, because, our medications are very expensive. So we'll go ahead and get started. So we're going to talk about, we're going to identify sources of uncertainty in MS. We're going to learn strategies, how to kind of handle unpredictable symptoms, and we're going to talk about mental agility because that's something I can teach you. I can't change that we have MS. I can't change that it's a disease that has uncertainty, but I can help you with some tools. So the role of uncertainty in MS. So MS is often called a snowflake disease. It's because it affects us all very differently. So each of us are our own snowflake with the disease that we have. And but there can be some common uncertainties with this disease. So some is, kind of the timing and the severity of relapses. I've had MS for myself for about 20 years. And it's different than I have a really good friend that has MS too. Her 20-year MS is a lot different than mine. But it's hard. It's unpredictable. I can't predict what the next 20 years will look like. And regardless, MS is a progressive disease. So even if it's a slower progressive disease, there is progression in the disease. It can cause some uncertainty with employment, which of course can relate to financial stability. And it can have impacts on relationships and your daily responsibilities. So these uncertainties are can definitely be challenging, and uncertainty in general can be challenging, but it also can be manageable. So we're going to move on to our next slide. I'm going to ask you a little bit about uncertainty. What uncertainties related to MS affect you the most? And how do they make you feel? So I'll get us started because I do that sometimes just to give us a little bit of time for people to type. So I think the uncertainty that that bothers me the most about MS is just the sometimes the day-to-day stuff, with fatigue or symptoms like that, like how sometimes you can't really predict it. So that probably affects me the most because I have to do a lot of pivoting. Um, Anne says I urge people to solidify their primary care doc and their neurologist relationships, and because sometimes the teams can help with insurance companies, and that's very true. Okay, so we're on to Katrina says finances can make her feel insecure. Linda says, I never know if I'll wake up with fatigue. Julie says the bathroom. Rick says movement and cognitive issues. And then Jim says, how long will I be able to take care of myself? And then, and where? And that could be scary, feeling so scared. And Katrina says, relationships and feeling alone. So there's a lot of uncertainties that you can feel with disease. Anne says, I worry about making forward thinking plans. Like, do I get a dog? Do I move in? Do I take a trip? Do I live solo? Yeah, those are all things, that, because it's hard when you have a disease that you just don't know. Paula says, checking into assisted living facilities and money issues. Rhonda says, I'm dealing with bladder issues, which keeps me at home. Sherry says, relapses, you never know when they're coming, and will I walk again? So those are a lot of considerations and a lot of things that are definitely related to uncertainty. And Rhonda, I just want to, while we can't focus on this in the moment, I want to say I encourage you to talk with your doctor about some of the bladder issues, because there might be some resources, there might be some tools even that might be able to help you a little bit. Might not solve the bladder problems in whole, but there might be some things that might be able to help. Hi there, Amelia. Amelia says, I never know how I'm going to feel, like going to a gathering. Yeah, that can be tricky too. So we definitely know what it's like to have MS and to understand what uncertainty is. So we're going to move on to our next slide, and we're going to talk a little bit about identifying and prioritizing uncertainties. So this is just what I would call like a power tool, because there's so much in the world that we can't control, right? There's so much and that we don't know about, we happen to have MS, so we have a better understanding of some of the stuff for personal, but it's a lot. So I think it's good to kind of think about making a list of and prioritize the things that worry you in terms of the uncertainties. And I talk about fatigue. So fatigue would be like higher up on my list, because that's something that's day to day and it's pretty big. Whereas when will my next relapse be? I don't know, and that might be never. I don't know. And so that uncertainty or worry is lower on the list for me because it's not in my face today. So, but thinking about for you, how can you prioritize these uncertainties? That's just a tool. It's something to think about and something to possibly practice. We'll move on to our next slide. So we're going to talk about some practical strategies, focusing on what you can control. So, some examples here, and you can go in the chat box if you want to and highlight some things that you can control. But some examples are you can, if we can go back to the other slide, please. Medication adherence, attending appointments. We can healthy lifestyle habits, being like nutrition, stress, management, connection with people. There's things that we can control. I always think when I get out of my bed in the morning, and I literally do this every day, and well, maybe not every day, but almost every day, in case I don't do it. But I make my bed. Something I can control, and it immediately makes me feel better. I don't make it perfectly, and I don't, I just push the sheets up and the pillows, make it pretty, but it's something I can control. Practical strategies are focusing on the things that you can control within your orbit, because that can be helpful. That gives you a sense of calm in the midst of uncertainty. And then clarifying with your health team. So we're going to move on to our next slide. So, this is really an encouragement to ask questions and to seek regular updates on, on your treatment plans. And then, of course, being involved in patient education programs, like this and like all the other programs that you might go to. But it's important. I think about 2 times a year, and that I really talk with my doctor, my neurologist, my MS specialist about MS progression. And it's usually the 2 times a year that I go to see him. Because if not, it's a worry and an uncertainty that I've got to clear my throat. Excuse me, sorry. It's a worry and uncertainty that that's always there. And I don't like to give it space in my day-to-day, everyday life because that would make me really anxious. But at my 6 month appointments, I'll say, okay, so I just want to ask, is there, is there any changes? Is there, any thoughts since, consideration since last time? And that gives me a space to address it. But making sure that you're talking with your healthcare team about your concerns and even just a general feeling of uncertainty. I've worked in the MS field for a long time, and I still talk to my doctor because I'm a person with MS, and my experience is mine, and so I want to have his opinion on it too. So we'll move on to our next slide, and we're going to talk a little bit about how we master the art of adapting to the unpredictable. So we'll move on to the next slide. So with MS, there's some symptoms, and we talked about them a little bit, and that can cause a lot of frustration and anxiety sometimes, and even worry. So I need to read something real quick. So it looks like Anne said she sought out cognitive therapy and physical therapy before she really needed it, and it made it feel more prepared. She was diagnosed in 2004. That is a very smart thing to do, is to not wait until after. And you'll see that there's some proactive strategies in here too. So the unpredictability of MS, the symptoms that can fluctuate, such as like fatigue, numbness, cognitive changes, even balance, or sometimes even, with walking, etc. There can be changes that just fluctuate from day to day, feeling, people might feel weaker or stronger on different days. And that fluctuation and unpredictability of symptoms can lead to frustrations and feelings of helplessness because we feel like we can't control. We can help to, in this chat, we talk a lot about stress management and things that we can do to help make stress a little bit better. But at the same time, and to help to do things that keep inflammation down in our bodies. But it's hard because it can make us so helpless because these symptoms are a part of our disease and they ebb and flow sometimes. So we're going to reframe adapting. We're going to move on to our next slide. So again, this is a power tool. So a couple things to know about adaptation. When we're adapting to change, this is a skill. It's not a burden. So think of it as like a power skill and something that you can implement, that you can do. And it gives you flexibility and allows you to regain some control in your day when you're able to adapt and adjust. Adapting can be reframed as a skill. So just think of it that way, because it's learnable and it's an internal process. So everybody's process is a little bit different, but it's internal. And rather than it possessing like a response to a change, you can be proactive. And so it can be more of a proactive, positive mindset. So here are some things to think about with an adaptation. It's a strength that can be developed. It's like a muscle in many senses. So it's like problem solving or communication, and it evolves and improves as you continue to practice it. Think about during COVID, you probably had to adapt quite a bit and had to pivot quite a bit too. So, and then with MS, you have to do it quite a bit too. And so think of yourself as already like probably someone who understands and knows how to do it some, but the more you do it, the more it allows you to build that muscle. And it's a form of mental agility. So just like physical agility that athletes do, mental agility allows us to be flexible and allows us to pivot amongst circumstances. And it's active and not passive. So it gives you a sense of control. And it's a trainable mindset. So this is one of the things that I probably, as a therapist, I've loved the most is that you can teach skills that can help people modify the way they think and feel and behave, and you can help teach skills that can help people look at things from different perspectives. And so this gives you power. So think of it that way. So we'll move on to our next slide, and we're going to talk a little bit about practical strategies for adaptation. We're going to talk about pacing and energy conservation. I'm going to stop and read for just a second because I see I got it. Paula said, I've learned young to just go with the flow and be calm, and it helps her. That is great. Jane asked if we could talk briefly to help reduce inflammation in our bodies. This is stressful because most of us don't know what to do to help ourselves. So we'll pause here real quick and we'll talk about that. I'm also going to encourage you to go back to some of the stress management videos that the MS Mental Wellness Chat has done on stress, because in the YouTube library, because I talk about inflammation and stress often. So inflammation is bad for our body, and when we are stressed, our cortisol increases, and in our body goes into a fight or flight state. Sometimes that can be short and temporary. Sometimes it can be prolonged. But it's bad for our body. It's inflammatory, and there's other things that are inflammatory our body, certain foods and things like that. And there are ways that you could go see a nutritionist, and there's lots of education programs on the nutrition part. And since I don't have my degree in nutrition, I'm not going to talk about those. But I'm going to talk about stress because I have a degree that can help you in that sense. So when we're thinking about stress management, we're thinking about things that we can do proactively, not reactively. There's things that we should do reactively, but proactively for stress that can help us deal with inflammation. Because if we're staying in that stress cycle, we're going to stay feeling, our inflammation is going to be a little bit higher. We're not going to feel as good. And there is a really big correlation with stress and relapses. That's why, and even pseudo relapses. That's why when we tend to feel a lot of stress, we don't sleep well. If we don't sleep well, our fatigue is worse. Our fatigue's not as worse, then our cognition won't be that great. So there's a lot of how this all holds hands and connects to this. And when you're facing with uncertainty, often it's a state of stress. You will feel stressed. So some of these strategies that I'm going to share are related to the uncertainty of MS, and then I'm going to share some, related just to the uncertainty of life, and that goes in like sort of the stress category. So practical strategies for adapting is pacing and energy conservation, taking breaks into manageable steps, or breaking tasks into manageable steps. Then taking breaks. And looking at tools like a fatigue management planner. What I do, and that I've encouraged other people to do, is to pay really good attention to your body, and really pay attention to like your levels of sleep you're getting at night. Are you eating well? Are you exercising a little bit, or taking a walk if you can, or if you're not able to walk, doing some exercise, going to the doing water aerobics or something. But doing the things that you need to do to manage the fatigue, but then also listening to your body, because you guys know as much as I know, fatigue is something that sort of just comes in, and you need to respond and react to it sometimes. So you need to rest and pace yourself. But there are some things that you can do to help with that unpredictable nature of some of the symptoms. And having little things like I will have usually fans by my desk because I can get hot easy. Having little tools to kind of help, it's like a way to adapt, because in all settings, I'm not able to just close my eyes, but also making little power naps and things like that can help. So we'll move on to our next slide, and we'll talk a little bit about symptom tracking. So keeping a log of your symptoms to identify patterns can be very helpful, and this is, I think, especially helpful to share with your healthcare providers. Now, if you do track your symptoms, I would make sure that you look at them before you go to your healthcare provider and have a summary, sort of like since 3 weeks ago, I've been experiencing apathy or a lack of motivation, or for the past 2 weeks, I haven't been able to move my right leg as well. But just tracking your symptoms so that way you can understand what's happening, and also you can share that with your healthcare provider. And it actually can help to anticipate, like if you're able to anticipate, potential triggers or flares or anything, you might see a pattern. I definitely can, when I have tracked symptoms, you can see patterns based on kind of what's going on in life, what's going on with stress, what's going on with my body, what time of year it is, all of those things. Paula said she started chair yoga this month and is feeling better. Congrats, Paula. Let me know, are you doing it online or in person? I just wanted to see, but doing things like that on a proactive level can really, really help. So tracking your symptoms is something you can do to adapt, that you can modify. But then the other thing I want you to think about is building a support system. So we'll move on to our next slide. Okay, so this involves your family, your friends. It might be at your group. This is a group. We're a community here. Goodness, wouldn't it be amazing if we could see each other one day? But we're a community here, and so involving those people to help navigate challenges, having open communication about symptoms, and that can help to reduce misunderstandings. We on the MS Mental Wellness Chat I've done a couple of programs on communication, so I'm not going to do the depths of communication. It's a very popular topic. We'll do another one this year, but it's an art too, is finding out and figuring out how to adapt, and how to share those things with people. So here are some social and supportive strategies. So I want you to, when you're facing an uncertainty, stay connected to your support network. It can feel so easy, at that time because of uncertainty that you're feeling more overwhelmed, to kind of back off a little bit. But you engaging with your peers, engaging with your counselors or support group people in your family, that can help you to feel better, even though in the moment you might not want to. Paula also shared she is doing the in-person chair yoga, and any new symptoms she puts on her calendar. Very good. Thank you for sharing. And so we want you to stay connected. So when things feel uncertain, don't pull away. Stay connected to people that are important to you and that support you. Learning how to communicate your needs clearly, letting others know if you need emotional support or practical support, like literal, support. People respond better when you tell them what you need, what support you need, and instead of letting them guess. And then also, I feel like I have a bunch of people on this call that already do this, and probably could speak up to doing it. But practicing resilience building behavior. So surrounding yourself with people who navigate in uncertainty with flexibility and optimism. So people, if you people that you might look at and say, they're resilient in how they act and how they respond to things. I want to be around them, or modeling some of that too. Some of the things that you learn on here, or you learn from each other that you sharing those and modeling those for other people too, as well as for yourself, it can be a great thing. So let's move on to our next slide. So we're going to talk about building mental agility, and this is for life's curveballs. And goodness, we get a lot of curveballs in life, don't we? I feel like this past month, even with just even we think weather, January's been a long month with a lot of things going on. So life has curveballs, and so we can practice mental agility. So let's talk about what mental agility is. We'll switch slides. So it's the ability to shift perspectives, to enter into kind of like a problem solving in a creative way, and to stay flexible when plans change, because plans change in life. It's I'm a planner. I love a plan, but plans change. And so and it, instead of when you develop emotional agility, this is something you can work on, that you can build like a muscle. And so what you'll do is, instead of avoiding difficult feelings, you learn to adapt and to move through them with compassion and with self-compassion. So it's a great way to face things when you're not sure, when things change, and when things are uncertain. So it's a key, this mental agility is a key skill with MS, and it can really impact and be helpful for a lot bigger, broader challenges. And it helps with your emotional regulation because it gives you some control. And if I can give you anything in this mental wellness chat, I want to give you some control in areas, because we don't have control of everything. So what are the benefits of mental agility? We talked a little bit about what it is, but what are the benefits? We'll move on to our next slide. So it will reduce stress during unexpected situations, because it takes you from a place of being maybe like that things are out of your control, to a place of a little bit more control, or a place of I've got this, or I can handle this. So it kind of changes how you approach things. It improves your problem solving and decision making. And sometimes we can be in a land of indecisiveness, like what should I do? What should I do? And so this will help you to flex and to make plans, and to be able to adapt. And it enhances your confidence as you're navigating the unknown, because the truth is we are all kind of navigating a lot of the unknown. So here are some practical strategies on building mental agility. So one of so this is really for thinking about the first step is like mindfulness and emotional regulation. So this is kind of what we're going for, and this does help with building mental agility. So practicing grounding techniques. I'm going to ask you in the chat, how many of you remember what the grounding activities are? Like deep breathing, or the exercise where we do the 5, 4, 3, 2, 1, and sensory grounding. If you remember what grounding is, remember that grounding is is helpful for mental agility. If you don't know what grounding is, I will share that one of the grounding exercises I think that can be the most helpful is deep breathing. And that's where you breathe in through your nose and out through your mouth. But you might breathe in for a count of 3 and out for a count of 6. That can be very helpful. The other one is thinking about your 5 senses that you have. What are 5 things that you see right now? What are 4 things that you hear? What are 3 things that you can touch? What are 2 things that you can taste? And there's another one. I'm sorry, I wasn't prepared. I didn't prepare for that one. Real quick to share, but thinking of your 5 senses and how it applies. And so, what does this do? Well, it helps to manage like overwhelming emotions. Anytime that you're experiencing any symptoms or anything in life that is creating a lot of immediate feelings of emotional lability or stress, frustration, etc. And then practicing mindful acceptance. We talk about this a lot, and it's allowing yourself to be kind of present in the moment and in the feelings that you have, and not being mean to yourself. Paying attention to how your body feels, and not judging yourself how you feel. So if you're frustrated or sad about something, just allowing yourself to say, I'm kind of frustrated that I just don't know this right now, or I'm frustrated that that the symptoms here right now, and it makes me sad, but I'm going to own it. So I'm going to read a couple more Kanita uses the progressive relaxation, the head to the toe. That's such a good exercise. I love progressive relaxation. You can Google that, and you would be able to find exercises that are really good. Also, apps that are like the Calm app, et cetera, would have stuff like that. John says evening reset, music and reading. Not sure if that's a grounding technique. Reading is like kind of like almost like distraction technique. Music maybe, and it could be both too. But I think grounding, like in the sense that you're paying attention to what you're doing and all the senses with music, etc. Kanita said head to toe. Yeah, I got that. And then Katrina says routine helps me, but when routine changes, it takes me longer to adjust and adapt to the with good changes. And she said, thank you. Need to work on mental agility. Just remember, mental agility is a muscle. And so we're going to talk about like kind of practicing some flexibility and internal flexibility as well. But allowing yourself to feel how you feel. And that's the truth is you've got to own your feelings, because if you try to brush them away, you won't be able to deal with them. And if you own them, you can move through them faster. And you can, okay, I feel sad, but I feel sad and this is how I feel. I'm not going to judge myself, but now I need to do the next step. And so making sure you're naming, you're validating your emotions, acknowledging your worries, don't suppress them. And you can even say, you know, I'm feeling uncertain right now, and that's okay. That's understandable. So another practical strategy is to, we're going to talk is more cognitive related. We'll move to the next slide. So for the first one is to change catastrophic thinking, because sometimes our brains will do all or nothing, and it's a cognitive distortion. But in times of uncertainty, we may think, what if this gets worse? What if this gets worse? You know, and another way to think about it is, what small steps can I take every day to, or can I take today to manage this? So it's kind of getting through the day instead of thinking about things that you don't know. Focusing on realistic and actionable steps. And this is easier said than done. And I get it. I've had a, you know, I've had a really bad relapse. I've had relapses, but I've had a really bad relapse in my MS life. And I remember, am I gonna be able to get feeling back in my leg? And you know, that's hard. And you know, and so making that shift to those small steps. Well, what can I do to help manage this today? Gives you again some control. Renee says deep breathing helps me sleep all night. Deep breathing is a really great technique. So then other cognitive strategies I want to share is, you know, reframing uncertainty as possibility. So this is more of a general one. So this is not necessarily MS related, but instead of fearing the unknown, considering it an opportunity for growth. And so reframing something, you know, what is it that I can learn here? And this, again, that doesn't explain bad things and things like that either. So I'm not trying to excuse that, but it just gives you an opportunity to say, is there something else I can see from a different perspective? Or is there a different way to look at this? You know, it's sort of, I remember many years ago missing a flight with my family for a vacation. And I remember being frustrated about it because I'm a planner, but also it proved to kind of give us an adventure, to be honest, and a story later. And so it's that kind of thinking. So whenever we get close to missing another flight with my family, I'll remember that it could be an adventure too. So also using cognitive restructuring. Identifying, you know, when you have a catastrophic thought, you know, ask yourself, what is the evidence for this fear and what is a more balanced perspective? I always think about what would a good friend tell you, a good logical friend tell you, or what would you tell a good logical friend? Because often you would give them the logical advice that you're not giving yourself. And so, you know, or talk to somebody even, that does have that perspective, and ask them, like, what are your thoughts? So that way you can kind of learn to sort of apply that to catastrophic thinking. Amelia says, yes, stay away from catastrophic feelings. And then Anne says, my strategy, this will resolve one way or another in blank days, months, years, zoom out. So when we're looking at ways to deal with the cognitive piece, this is going to help us with stress. This is going to help us with any anxiety, sadness that we have. Does it take away the problem? No, but it helps us to start to adjust with it and adjust to it. And the cognitive piece is really important, because without the cognitive piece, anxiety runs the show. Very much so. So we're going to move on to our next slide, and we're going to talk about also practical strategy for mental agility is practicing flexibility daily. This is important, guys, because we can become very rigid in what we do. And so when things change or get in the way, it can make it really difficult. So when we practice adjusting our routines or trying new coping techniques, this is important because things will happen often. So building flexible routines. Having structure helps. And so I don't want to take away structure, because I'm a planner by heart, and I'm going to always be pro plan and pro structure. But leaving room for a little bit of, adaptation if you need to. And this can be helpful with MS too, even. So making sure that you're building in a little bit of extra space and time if you're planning to go to an event, etc. Or if you're anticipating, it really throughout your day, building a little bit of space and time. I usually have a little buffer built into my day if I'm dealing with fatigue, and how I can kind of manage that. Just giving yourself a little bit of flexibility. Celebrating successes. So this is important too for your daily habit, and it's and when you're doing this, you're building resilience. And when unexpected changes occur and you deal with it and you cope with it, celebrate that you did that, because those are really, really big. Even if it's small things, allowing yourself to be recognized for yourself for being able to deal with a change. And then take small intentional actions. So even when the future is unclear, small steps towards a meaningful goal creates a sense of agency and a sense of control. And again, that's what we're aiming for. We're not aiming to feel like we're in control of everything, but have some control within ourselves. And also allowing yourself to use problem-solving techniques. So if certain uncertainties lead to stress, defining the problem and kind of brainstorming solutions and being able to take actions whenever you can. So trying to be proactive too, and allow yourself to go into problem-solving mode. When you can be proactive with those, that's amazing, but sometimes we have to be reactive too. So we're going to move on to our next slide. And I just thought this would be kind of fun. We'll see if it goes. Okay. I used fatigue just because it was the easiest thing to think of. But let's imagine that you have sudden fatigue before going to an important event. What is a flexible strategy that you could use to address this? So this is kind of just an idea, thinking out of the box. So sudden fatigue comes up before something important. What could you use to address this? So, for example, so before this program, I had a little sinus headache that came with fatigue. And what was the flexible strategy? Because I couldn't change the time that I had to show up for this, but I could change some of the other things that I had to do to prepare. And so I'm not prepared literally because I'd already put together the presentation, but instead of taking a shower and such, I took a nap, and so. And then before the program, I did a little bit of just kind of like breathing and resetting exercises to help wake my brain up a little bit. So David says breathing. So this is important to think of, because there's, you may have things before something important, and is thinking about what flexible things could I put in place? What graces can I give myself? What Jane says, lie down for a short time, whatever you can squeeze in. That's a great idea. Rhonda says, focus on what you can do, enough to complete the task. Katrina, I like this too, Katrina. She says using wheelchair instead of walking. So finding a little so if you know fatigue is going to be the thing, what is one way that you can save energy? Liz says have a glass of water. So there you go. So I like this. We're problem solving and thinking about some things we could do to be flexible, because the reality is that things are going to happen and interrupt the ability to do things in the way that we wanted to do them. So we have to be kind to ourselves and also grace, and give ourselves grace to do things that we want to do still. And so we can address it, and that is very successful. It gives you a lot of mental agility. We're going to move on to our next slide. So before I talk about this, we can leave this slide up, but I just wanted to talk about prioritizing self-care and well-being during times of uncertainty. And so this is prioritizing rest and nutrition. Stress is exhausting, and maintaining good sleep, nutrition, movement really will support mental clarity and maintaining socialization. Engaging, this is my favorite suggestion, is to engage in meaning-making activities. So it may be through nature, through spirituality, through creating something, or advocacy, focusing on things that can counteract that feeling of instability. And for me, I usually am here as of late. I paint every evening most of the time, and so that kind of helps me to kind of just take care of myself. And it's a good mental wellness thing to do, but it makes me feel like I'm doing something that is meaning making. So I pulled these next two slides from some of the COVID materials that I when I did a presentation a while back, and so I'm not going to go through all of the examples, but I think when we're dealing with changes with MS, there's a lot of new little normals that I know we adapt to, and then when we also have uncertainty in life, there's a lot of new normals that we adapt to. So just some key things about this is moving forward to your new normal is going to be different for everybody. And this is your own experience. So you will go through whatever process on your own in your way. Always have a list of things to look forward to. So if you're going through changes with your MS or uncertainty with your MS, or something in life is giving you that feeling, have little things to look forward to. I think the big things are really fun and really cool, but they're here and there and hard to find sometimes. The little things are really nice. And be patient with yourself. Again, that non-judgmental feeling. It is okay to feel upset. It is okay to feel anxious. It's okay to feel hurt. It's okay to feel angry. It's okay to feel how you feel as long as you own it. It's not okay to react around, depending if you're angry, but it's okay to feel how you feel. And I want you to give yourself permission. Do what feels most comfortable to you. And don't be afraid to express those preferences to other people. And if something happens and you need to step back for a moment and just kind of regroup and figure out what you need, that's okay too. So we'll move on to the next slide. We'll move on to the next slide. Actually, I already talked about that one. So the new normal is not the old normal. So don't expect, everything to be as it was, so that's a big part of adapting is, and luckily, sometimes with MS, that we get little abilities to practice that mental agility and stuff, and we get that flexibility that we get some space to do that. Making sure as you have developed a new normal for whatever that is, that you make space to connect with people and that you interact and keeping those social engagements, that you're if you've had to step back from that to try to, to maintain that as much as you can in your new normal. And if if you have a sense of like loneliness, so maybe that you've been I was thinking my Michigan person who's stuck in for the snow, but if you've been feeling lonely, to make sure that you're making some deliberate intentions to increase some of your social connections, by either clubs, groups, or classes, some online like this, and maybe some in person. So we're going to move on to our next slide. And one more slide. Yeah. So identifying unknowns and uncertainties are tricky. Being able to address them is very important. And learning how to adapt to them is even more important, because if not, it can leave us in a very big state of stress. And we talked a lot about stress. And mental agility, I want you to know, this is something that's teachable for yourself and something that you can grow, and you don't have to do it tomorrow. I think about even I used to be not flexible at all in my thinking, and then being a clinician, being a social worker, and I think just life really has made me a lot more flexible in my thinking and my ability to react, and my ability to step away from a plan. I still don't like it, but I can do it a lot now too. So just thinking of that as mental agility, things that you can strengthen. So Anne says, manage expectations. If people are expecting you, under promise and over deliver. I'll be 30 minutes late unapologetically. Yeah, I think, I think being honest, and also like, yeah, like not putting yourself in a position that that you feel like you're setting yourself up for failure, that you're really setting yourself up for success. But I like that reframing. And then Amelia says, have a glass of water is great. Thought you were about to say have a glass of wine. Not necessarily a bad idea. Water will be perfect. I like that smiley face as well. So takeaways. Mental agility is learnable. So this is something that fosters resilience. Resilience is something that helps to make you stronger, give you a better sense of emotional wellness. So this is a really good tool for you. Living with MS is a journey. And I know this, and you know this. But if we can learn to deal with unpredictability, uncertainty, and learn to practice and foster that mental agility, you can really help. You have a lot more confidence when things are out of your control. Now, it does not mean that things will be perfect to navigate, but it will help you a great deal. Kanita says, difference between react and respond. Oh, it's a question difference. What we want to do, so I think of react and respond kind of being a little bit of the same. Like proactive, I think, is the what you're going to do to well, no, I'll reword that. So respond would be is that you have a stressor and you respond to it. React is maybe no, I'm going to go back to proactive. So when you're proactive, you're dealing with it from the very beginning, and you're anticipating it. Reacting is to me feels very reactive, like kind of after the fact. Respond could be that you feel this happening and you're responding, so it feels a little bit lighter. But the truth is that knowing when to implement all of these things is important. So knowing that sometimes, to be proactive with the resources and these tools. Sometimes, we feel like, oh, I feel stressed because this just happened, and you couldn't have prepared for it. You couldn't have been proactive with it, but you have to respond to it. And then the reactive maybe is, when you're really feeling it in your body and you realize, okay, there, this is a big deal. My anxiety is higher, my depression is higher, my sadness is higher, my fear is higher, and you're reacting. That's maybe the best I could finesse the differences. But the point is that you do have some control. So we're going to thank Beatrice again for their support and MS Views and News for the mental wellness chat. You guys are an amazing community. You have no idea how cool this group is and how long it's been going and how much you show up for one another. So I'm so thankful to be a part of it. So I always end with this. I've for the over 3 years I've been doing this. I don't like to say goodbye because this is a community. This is going to be here every month. It may vary a week to week just based on a unpredictable circumstance, but I'm here, and so we're not saying goodbye. We're saying we'll see you later. I'm so happy you came on to the mental wellness chat tonight. I wish you well and know that you can build that mental agility. I'll see you next time.